Now back to Roger and Marilyn
on CHUM FM.
That temperature continues to rise. We're at 13 degrees now at 8:25 in the morning. It's going up to 16.
Oh,
but it's
16. Come on. Did you say 16 February 23rd?
That's right. But apparently it's not going to stay there very long. It's going to start to fall. And the overnight low tonight will be 2.
Oh.
And tomorrow's high will be just 4 degrees.
Wow. All right. Please welcome to the room Dr. Frank Lista from the Plastic Surgery Skincare Clinic. Yeah. Thank you. Dr. Frank Lista, we need to get red carpet ready. What are all the stars doing right now?
The stars are doing everything. It's the week before. They're getting all ready. They're having their faces all done.
But in a lot of cases, people have to start with some of these procedures. They have to start months in advance, like IPL. Can you talk about that?
Well, for surgery, you need to start months in advance.
Yeah.
But, you know, so many now are doing non-surgical things. That's So IPL is moving away from a regular facial. Mm-hmm. And it's not a laser. It's intense pulse light. And if you shine a really bright light on the skin, it makes the skin look younger. It doesn't need any downtime. You'll be a little pink for a day, but then a week later, which should be just about time for the Oscars, your skin will be glowing.
How many treatments do you have to really get the best results?
Well, you know, you'll see a difference after one treatment.
Right.
But we say, you know, once a month for about 3 or 4.
Yeah.
And that's when it's the best. But they're doing it right now.
Yeah.
They're doing their Botox and everything right now.
Well, yeah. Now, is it taking, it takes care of a little redness, maybe a little rosacea?
Right. So it really evens out your skin tone.
Yeah.
So it gets rid of those little red, those little red marks you get around your nose, the little broken blood vessels.
Yes.
And also what we call dyschromia, the little brown patches. It makes your brown patches go away. So it really evens out your skin tone.
Flawless. So when the makeup actually goes on, it is flawless.
Yeah, a lot of it's about getting the makeup on smooth. It also makes your pore size smaller. So for women, when your makeup goes on, it really goes on well.
Right.
But for men, men are doing it as well because even if they're not wearing makeup, it makes your skin look really great.
Yeah, it's like that youthful kind of glow.
Yeah, your skin sort of glows from underneath.
Dermasmooth, what is that?
So that's sort of it's a new treatment that's really taking over plastic surgery and dermatology. It's radio frequency treatments. So we're getting away from lasers because lasers were causing damage to the skin. So we're trying to make the skin better without hurting it. So it's radio frequency, a really intense radio frequency signal which is placed on the skin, and it heats up the underlying collagen, makes your skin tighter and smoother.
Do you do it around the eye?
Yeah, especially around the eyes. For those little fine wrinkles around the eyes.
So as you get older, our kind of elastins kind of sag a little bit.
Yeah, so the 3 things of aging: deterioration, descent, and deflation. So descent is always surgery. That's all we've been concentrating on. Deflation is fillers, but deterioration is really where it's at. We're trying to reverse the things that have happened to your skin as you grow older.
To get the best results, Dr. Lista, would you have to do a couple of sessions to get it? And what is the downtime?
Right. So no downtime with the radio frequency treatment. You can have it done and then be going out that night. You might be a little pink that night, but the next day you're fine. And a couple of treatments is always better, but people say they notice a difference after one.
And then Botox, the good old Botox.
Botox. I'll bet you there isn't someone on the red carpet who hasn't had Botox. It's like
Botox and Spanx, Dr. Lista. That's what it's all about.
Well, the funny thing is that when I first started practicing, the only people who were having Botox and fillers were 50 and 60-year-olds. Now we have 20-year-olds having Botox.
And why are they having it? What is it?
Well, because Botox is the only thing that we have that prevents wrinkles. So, if you're constantly frowning in a certain way, the skin is attached to the muscle and it just develops a crease, and that crease becomes permanent. That's what a wrinkle is.
That's that little thing in between
your
two
11s, right?
eyebrows.
So, you see lots of young people who, even when they smile, they have 11s. Eventually, that's going to become a permanent crease. You Botox it. You can still move your forehead, but that permanent wrinkle won't develop.
So we know what women are doing with Botox. What are guys doing?
Oh, my goodness. Men are doing it as much as women. When I first started practicing plastic surgery, men were like 1% of my practice. Now they're almost 50%.
And where are they getting the Botox?
They're getting the same place everyone else is, in their foreheads, and around their smile lines.
What are they calling it, though?
Botox.
Botox.
Roger, come on.
We're talking with Dr. Frank Lista from the Plastic Surgery Skincare Clinic. What about peels?
So, that's part of your regular skincare program. So, the worst thing you can do is do nothing and then say, okay, I got to be ready next week. I need to do something. Look, it's skincare is how you take care of your skin every day. It's like going to the gym. You need to make your skin's an organ. You got to take care of it.
Right. So fillers, do you find that people are dialing back on that, especially on the red carpet?
Well, we're dialing back on it.
Yeah.
Like I tell you, lots of times we have to say to people, you've had enough.
Really?
But, filler is the most powerful thing you can do because remember, one of the things of aging is deflation. And so we want to reinflate areas that have lost volume. And, if you do it really well, you can't tell that someone's had it done.
It sounds like people are doing multiple treatments, and they love the fact that there's no downtime in a lot of these cases.
So that's the thing. You don't want to make someone look completely different. Many little things, little tweaks, make it look better. Because aging's not about one thing, so fixing it's not about one thing.
So when they come in for a consultation with you, you'll go over a program with them? Is that what you do?
It always, it's like a pyramid. Skincare at the bottom, minor peels next, then injections, then fillers, and surgeries at the very tip, at the last thing we think about.
Okay, thank you, Dr. Frank Lista. We'll be looking at that red carpet and all those Spanx.
Thank you.